You wake up. Your tongue feels like sandpaper. Your lips are stuck together. You reach for water before you even open your eyes. Most people blame the room. Too dry, too hot. I need a humidifier. Here's what almost nobody tells you. Waking up with a dry mouth, night after night, can be one of the earliest signals your body sends before bigger problems show up. Things like poor sleep quality, blood sugar issues, thyroid trouble, or a breathing problem you don't even know you have. This isn't about scaring you. It's about teaching you to actually listen to a signal you've been ignoring for years. By the end of this video, you'll know exactly what dry mouth might be telling you, how to tell the difference between harmless and pay attention, and the 5 things you can do starting tonight to fix it. Let's get into it. Here's the thing about dry mouth. It's so common that we've all just accepted it. It's the health equivalent of a check engine light that's been on for so long you forgot it was ever off. But saliva isn't just spit. It's doing serious work every single night while you sleep. It washes away bacteria and food particles. It neutralizes acid so your enamel doesn't erode. It keeps your throat and airway lubricated. It's part of your body's first line of immune defense. When you stop producing enough of it overnight, that's not random. Something changed the environment in your mouth, your airway, or your body's chemistry, and most people's response? Chug water, maybe buy a humidifier, and move on with their day. That might mask the symptom for a night. It does nothing about the cause. Here's what makes this sneaky. Dry mouth rarely shows up alone. It's often the first noticeable sign of something that's been quietly building for months before the more obvious symptoms show up. By the time people connect the dots, they've usually been dealing with poor sleep, low energy, or worse breath for a lot longer than they realize. So the question isn't, how do I stop my mouth from feeling dry? The question is, what is my mouth trying to tell me? That's what we're breaking down today. Quick gut check before we go further. Does this happen every night or just some nights? That one distinction changes everything about what's causing it. Keep that question in your head. We'll come back to it in a minute. Let's go through the real, evidence-based reasons your mouth dries out overnight, from the mundane to the ones worth actually paying attention to. The first is mouth breathing. This is the single most common cause, and it's almost always overlooked. If your nose is even slightly congested, from allergies, a deviated septum, or just sleeping position, your body defaults to breathing through your mouth at night. Air moving over your tongue and the roof of your mouth for 7 or 8 hours straight will dry it out completely. How to tell? If your dry mouth is worse on one side, or worse when you sleep on your back, or you wake up with a sore throat too, mouth breathing is very likely your answer. The second is dehydration, the boring one, but still true. Caffeine, alcohol, sodium-heavy dinners, not drinking enough water during the day, all of it catches up to you overnight when you're not sipping anything for 7+ hours. This one's easy to test. We'll get to that in the steps section. The third is medications. This is a big one almost nobody thinks about. A huge number of common medications, antihistamines, blood pressure medications, antidepressants, decongestants, list dry mouth as a side effect. If you started a new medication and the dry mouth started around the same time, that's not a coincidence. The fourth is sleep apnea. This is the one worth taking seriously. Obstructive sleep apnea causes repeated pauses in breathing throughout the night, which often forces open mouth breathing to compensate. People with sleep apnea very commonly report morning dry mouth, alongside snoring, gasping awake, morning headaches, and daytime fatigue even after a full night's sleep. If dry mouth is paired with loud snoring or you wake up feeling like you never slept, that combination is worth mentioning to a doctor. The fifth is blood sugar changes. Persistent dry mouth is also a recognized early symptom people notice with blood sugar irregularities, since elevated blood sugar can pull fluid out of your tissues and increase urination overnight, both of which dehydrate you further. This isn't a diagnosis, it's a pattern worth being aware of, especially if it's showing up alongside increased thirst or more frequent bathroom trips at night. Let's pause here for a second because I want to be really clear about something. This video is not here to tell you that you have a specific disease. I'm not a doctor, and this isn't a diagnosis. What I am telling you is which patterns are worth paying attention to, so you know when drink more water is enough and when it's time to actually get checked out. With that said, here's what to actually do about it. Step 1, run the 1-week water test. For 7 days, track 2 things: how much water you're drinking during the day and whether your mouth is dry when you wake up. If you increase your daytime water intake and the problem disappears within a few days, congratulations, it was dehydration. Simple as that. Most people skip this step and jump straight to worrying. Don't be most people. Step 2, check your breathing position. Before bed, notice how you're breathing. Lips closed, breathing through your nose? Good. Mouth slightly open? That's your answer. Try sleeping on your side instead of your back for a few nights. Back sleeping makes mouth breathing far more likely. If nasal congestion is the issue, a saline rinse before bed or addressing allergies can make an immediate difference. Step 3, audit your evening habits. Look at what you're consuming in the 4 hours before bed. Alcohol dehydrates you and relaxes throat muscles, making mouth breathing more likely. Caffeine late in the day has a mild diuretic effect. Salty food pulls water out of your tissues overnight. Cut one of these out for a week and watch what happens. Step 4, check your medication list. If you're on any regular medication, look up whether dry mouth is a listed side effect. Or better yet, ask your pharmacist directly. They'll know instantly. If it lines up with when your symptoms started, bring it up with your doctor. There are often alternatives. Step 5, track the pattern, not just the symptom. This is the step almost nobody does, and it's the most valuable one. For 2 weeks, keep a simple note on your phone with 3 things each morning. How dry was your mouth on a scale of 1 to 5? How rested do you feel on a scale of 1 to 5? And any snoring, gasping, or waking up during the night, yes or no. If dry mouth consistently pairs with poor rest and any signs of disrupted breathing, that pattern, not the dry mouth alone, is what you bring to a doctor. That combination is far more useful to a physician than my mouth is dry sometimes. Let's zoom out for a second. Notice what we just did. We didn't panic. We didn't self-diagnose. We built a simple system to separate annoying but harmless from actually worth a doctor's visit. That's the entire skill here, not memorizing every possible cause, but learning how to read your own patterns. That skill applies to almost every symptom your body throws at you, not just this one. Quick no-fluff checklist. See a doctor if dry mouth is persistent most nights for 2 or more weeks, despite fixing hydration and habits. If it's paired with loud snoring, gasping, or daytime exhaustion. If it's paired with increased thirst, frequent urination, or unexplained fatigue. If you started a new medication and it hasn't improved after checking with your pharmacist. Or if you also notice cracked lips, mouth sores, or difficulty swallowing regularly. None of these guarantee a serious condition, but they're the difference between monitor it and get it checked. Let's bring it all together. Dry mouth isn't random. It's your body flagging a change in hydration, breathing, medication, or blood sugar. Run the water test first. It's the simplest explanation and the most common one. Check how you're breathing at night. Mouth breathing is the most overlooked cause. Audit alcohol, caffeine, and sodium in your evenings. Track the pattern for 2 weeks before jumping to conclusions, and bring that pattern to a doctor if it lines up with the warning combinations we covered. You don't need to panic every time you wake up thirsty. You do need to stop ignoring a signal that's genuinely trying to tell you something. If this actually helped you understand what's going on with your own body, do 2 things for me. Subscribe, because next week I'm breaking down another small symptom that most people brush off, and it's one that's connected to this exact topic. And drop a comment telling me, is your dry mouth every night or just some nights? I read these, and I want to know which one is more common in this audience. I'll see you in the next one.